Salam everyone, this is Mostafa Alyassin, a third year student, and today I'll be talking about organic nitrates. So, let's start talking about the classification of nitrates. Nitrates are classified into short-acting nitrates and intermediate-acting nitrates and long-acting nitrates. Now, for the short-acting nitrates, these are used for acute chest pain, while for the intermediate and the long-acting nitrates, these are used in between the pain attacks. Now, let's talk more about the short-acting nitrates. Amyl nitrate is one of the short-acting nitrates, which is taken by inhalation. Isosorbide dinitrate is taken sublingually, and nitroglycerine or glyceryl trinitrate is also taken sublingually. Both of these drugs is taken sublingually, thus they will be absorbed by the sublingual plexus of veins. IV nitroglycerine, which is the fourth type, is given to patients who are admitted because of acute chest pain, but none of the short-acting drugs worked. Now, please note that this drug is given under a precaution. But why? Why do we give it under a precaution? Since it can cause widespread vasodilation. Vasodilation causes hypotension, and this can result in reflex tachycardia, which is so harmful to patients with MI. Now, moving to the intermediate acting nitrates, which is isosorbide dinitrate. In this case, isosorbide dinitrate will be given orally, not sublingually. The sublingual form is considered one of the short-acting nitrates. The other form, is the sustained release nitrate. Now, the sustained release has duration of action between 6 and 10 hours, and the onset will be in 30 minutes. Now, for the long-acting nitrates, these include isosorbide mononitrate, and it has two forms, the sustained release form and the oral form. Now, as I mentioned, there is nitrates that are given by patches. Why do we give a nitroglycerine patch? Now, usually patients with ischemic heart disease suffer from pain at night, which we call nocturnal angina, and in the early morning also. But why do they suffer at this time specifically? Why do they suffer from pain at this time specifically? Now, the sympathetic tone is increased at this time between 5 a.m. to 8 a.m. So we give them nitroglycerine patches at this time, or when they sleep at night, to prevent this from the pain attacks at night. And these patches have a duration of action between 12 to 18 hours. Now, moving to the next point, which is the pharmacokinetics of nitrates. One good thing about nitrates is that they have a good absorption, but unfortunately, they have the first pass metabolism. What does this mean? What does first pass metabolism mean? It means that when they are taken orally, they are absorbed by 100%, but unfortunately, 90% of the absorbed drug will be destroyed by the liver, while only 10% will go to the circulation, which we call bioavailability of the drug. So, in this case, or in the case of acute pain, do we give patients with acute attack the drug orally? Of course, no. We will give them the drug sublingually, since it will be absorbed by the sublingual plexus of veins, then moves to the systemic circulation without passing through the liver, thus avoiding the first pass metabolism. If you check the doses of the drugs that are taken sublingually, you will notice that they have low doses, since all the dose will go to the systemic circulation. Now, one thing to note is that we have an exception. Isosorbide mononitrate can be given orally, and it won't have the first pass metabolism. Thus, it is considered a long-acting. So, isosorbide mononitrate is one exception. Now, let's move to the mechanism of action of nitrates. Mechanism of action of nitrates we can note from its name. Nitrates release nitric oxide, which is an endothelial-derived relaxing factor. which will cause the increased cyclic GMP. And whenever you see increased cyclic GMP, this means vasodilation, since it prevents calcium from activating myosin light chain kinase. Vasodilation will be more in veins than in arteries. Thus, what will happen is that the preload will decrease. Now, how nitrates are converted to nitric oxide? It is done by the MALDH enzyme or MALDH. The name of this enzyme is mitochondrial aldehyde dehydrogenase. This enzyme was discovered in 2002. Now, another mechanism of action of nitrates include that it increases the kind prostaglandins, which are prostaglandin prostaglandin I2 and prostaglandin E2. Both of these prostaglandins will cause vasodilation. Now, what are the pharmacological effects that result from this mechanism of action? What are the effects that result from this mechanism of action? First, you will talk on the blood vessels, the effects on the blood vessels. Now, as I mentioned, the increased cyclic GMP will lead to generalized vasodilation, and this vasodilation will be more in veins than in arteries, which will decrease the preload more. In addition, we will have the vasodilation in the coronary arteries, vasodilation in the veins of the face, which will lead to flushing of the face, because since these drugs are taken sublingually, this will result in flushing of the face, since the veins of the face will be dilated. So again, the drugs are taken sublingually, thus the veins of the face will be dilated, and thus we will have flushing of the face. Now, vasodilation again in the meningeal arteries, which will lead to throbbing headache. So the patients will come to you saying that after I took the drug you prescribed for me, I had throbbing headache. This is because of the vasodilation that's happening in the meningeal arteries. So again, generalized vasodilation leading to decreased preload, since the vasodilation will be more in veins than in arteries. Vasodilation in the coronary artery, vasodilation in the veins of the face, which will lead to what we call flushing of the face, and this is because the drugs are this type of drug is taken sublingually. In addition, vasodilation in the meningeal arteries, which will lead to throbbing headache. Now, what is the cause of tachycardia in patients taking nitrates? Now, the reflex action, because there is a reflex action against the vasodilation. We said that it causes vasodilation. Vasodilation will decrease the blood pressure, and this will result in reflex tachycardia. So again, we have vasodilation because of nitrates. Vasodilation will lead to decrease in blood pressure. Decrease in blood pressure will lead to reflex tachycardia, which we want to avoid. Reflex tachycardia. Okay? Now, one thing to mention also is that the patient will have tachypnea. Tachypnea will also be caused by hypotension that results from the vasodilation. Moreover, what we should mention is that the correct doses of nitrates that should be given to patients is the doses that don't cause hypotension, which will lead to both tachycardia and tachypnea. So the correct dose includes doses which are not, or which will not lead to hypotension, which in turn may lead to tachypnea and tachycardia. Furthermore, smooth muscles, furthermore in the effects, smooth muscles will be relaxed because of the cyclic GMP. Now, one thing also to mention is that nitrates also have effects on hemoglobin. Now, since we mentioned that nitrates will release nitric oxide, this nitric oxide contains free radicals. Now, these free radicals will cause oxidation of the hemoglobin in the blood. Thus, hemoglobin will be changed from normal hemoglobin to methemoglobin, and this will lead to methemoglobinemia. Again, tachycardia and tachypnea and methemoglobinemia will not happen only if we give increased dose or high dose. They will not happen in normal therapeutic doses. Now, moving to the next point, what are the clinical uses of nitrates? Now recall that angina was divided into classical, presbytal, and classical and presbytal angina, in addition to the acute coronary syndrome. Now, nitrates are usually used for patients with classic angina combined with beta blocker. Now, how to combine the mechanism of action with the clinical use? We took the mechanism of action. Now, how to combine it so we can memorize it easier with the clinical use, recall that the most important thing that leads to the increased demands of oxygen in the blood of the heart is the myocardial strain. So increased myocardial strain, which is also increased contractility, will lead to increased demands of oxygen in blood. Now, increased myocardial strain and contractility are related to the amount of blood coming from the venous side. And now I want you to recall also that we mentioned veins will be more dilated than arteries when nitrates are used. So when the venous side is dilated, blood will be more in the venous side. This will result in decreased venous return, and when the venous return decreases, the preload decreases. And this in turn will decrease the efforts needed for contraction on the heart. Thus, less oxygen in blood is needed by the heart. So again, this point is so important. The increased venous return will lead to increased myocardial contractility and the increased oxygen and blood demands. We don't want this to happen, so we give nitrates. How will they work? As we mentioned, they will increase the cyclic GMP. This will lead to venous dilation more than arterial dilation. This will lead to decreased venous return, so this will be cancelled, decreased preload, less blood is going to the heart, and since less blood is going to the heart, less efforts are needed from the heart. Thus, we need less oxygen and blood supply and less demands. Now, another point is that nitrates causes coronary dilation, as we just mentioned before. What is the point of coronary dilation or dilatation? This will lead to a better distribution of blood. Thus, blood will go more to the affected area by ischemia. So if we have this as an ischemic area, because of the coronary vasodilation, blood will go more to the ischemic area. So better distribution of the blood. Now the second category of patients that will benefit from nitrates are patients with MI. Why do we give them nitrates? We give them nitrates to limit the infarcted area. Okay? We give them nitrates to limit the infarcted area. The third category of patients are acute heart failure patients. Now to understand this more, in the case of acute heart failure, the heart, which is a pump, is not able to push blood to the systemic circulation. But why? It's either because the blood coming from the venous side is too much, or because there is increased systemic resistance. So in this case, we want a drug that causes both vasodilation, which will lead to decreased venous return, and decrease the afterload, which will decrease the demands on the blood, and the heart will push blood easier. Which will decrease the effort needed from the blood, which leads to heart push the blood easier. So we will use nitrates since it decreases both the preload and the afterload. Now for the patients who have acute heart failure and the heart is not able to push the blood, they will also suffer from something we call pulmonary edema. So we will also use nitrates. This is also because of the decreased after and the preload. Again, the heart will function in a better way, so the congested blood will move from the lung to the heart and then pumped to the circulation. So, acute heart failure will benefit, and the consequence of acute heart failure, which is pulmonary edema, will benefit. Since nitrates decrease the preload and the afterload, which is our aim in this case. Now, we mentioned that nitrates will cause methemoglobinemia. So we can use nitrates in cyanide, acute cyanide toxicity. In this case, we will benefit from methemoglobin, since the cyanide has a higher affinity to methemoglobin than the normal hemoglobin. Now, moving to the next topic, what are the adverse effects? We want to understand the adverse effects, not to memorize them. Now, hypotension because of vasodilation. We said that before. We will have hypotension because of vasodilation, which in turn will lead to the reflex tachycardia. We mentioned that this will happen in high doses. In addition, flushing of the face and throbbing headache because of vasodilation. Flushing of the face, since these drugs will be taken sublingually. Sublingually, this means the veins of the face will be dilated, thus the face will be red. Okay? And throbbing headache because of the meningeal arteries will be dilated. Now, one more adverse effect is nitrate tolerance. Now, how does this happen? How does nitrate tolerance happen? What is the cause of nitrate tolerance? Now, nitric oxide released from nitrates will cause oxidation of MAL-DH, which is the enzyme. Thus, the enzyme won't be able to work. Another explanation for this tolerance is that because of the prolonged vasodilation, because of nitrates, so nitrates will cause vasodilation, and this vasodilation will be prolonged. This will result in the activation of renin-angiotensin-aldosterone system. And the brain will increase the sympathetic activation, or will lead to the sympathetic activation, will cause vasoconstriction. Now, how to avoid nitrate tolerance? What to do in this case? We will make nitrate-free intervals. We will give the patient nitrates for 12 hours, and the other 12 hours we won't give him or her nitrates. For example, we give him one sustained release nitrate tablet at night and one beta blocker in the morning. So 12 hours without nitrates. We will give nitrates for 12 hours and beta blockers for the other 12 hours, and that's it. Now, moving to the last point, which is the instructions that we should tell the patients when we prescribe for them nitrates. We will tell them, please don't exceed the dose. We don't want the hypotension thingy to happen. We don't want the reflex tachycardia to happen. We don't want the tachypnea to happen. In addition, we want to tell them that keep nitrates with you at home, so when you have a chest pain suddenly, you can take it sublingually. Keep the drug away from light. This may lead to the expiration of the drug. And check between time and another the expiry date. Now, one important thing is that we should tell the patient don't and never take sildenafil nitrate with nitrates, since both of these drugs will cause increased cyclic GMP, which causes a widespread vasodilation, and the widespread vasodilation will lead to hypotension, and the hypotension will lead to the reflex tachycardia, which we don't want to happen in the patients of MI. And that's it. Thank you for listening. Bye bye.